Hello and welcome to the program. I'm Layo Adegoke. We begin today in the United States, where Somali-American Congresswoman Ilhan Omar is planning to initiate a process of impeaching U.S. President Donald Trump after his supporters stormed the Capitol building, the seat of the country's legislature. The U.S. president encouraged his supporters to protest against the certification of President-elect Joe Biden's win by falsely claiming that there was widespread fraud in the November election. At least 4 people were killed, with several injured during the violent protest. Let's get more on this story from the Director General of the Bolitag Center for International Diplomacy and Strategic Studies, Professor Bola Akinteriwa. Thank you so much for joining us on the program, Professor.
Thank you.
Now, the African Union and African leaders, except a few, like former Nigerian President Goodluck Jonathan, have been largely silent on this matter. What do you think is responsible for this?
I think one major reason can explain it all. It is the fear of the unknown. Fear of the unknown in the sense that American foreign policy is generally very consistent in terms of its strategic pursuit. So whether it is Donald Trump, whether it is Joe Biden, who else, institutional frameworks remain, strategic objectives remain. It is only the tactical approaches, foreign policy techniques that vary from one president to the other. While we are very sure that Joe Biden has the potential to upturn, to change many of the foreign policy stance of Donald Trump, how he's going to go about it is not well known. So, for any sagacious African leader, it is better to take it cool, to make haste slowly. That's the first point. The second point there is that African leaders themselves cannot be truly said to be leaders in its true sense of it. A leader is supposed to bear the brunt of the followership. But Africa does not have what we can call African foreign policy strategies, African foreign policy objectives that can compel them to now say, look, this unsettling of democratic positions in America is not good for us. We are being told that democracy is good, but the bastion, the epicenter, the terra cognita of democracy in the world is now being bastardized by the proponents of the same democratic values. So in this case, it's best for African leaders to just be an observer in a theater and see what is developing.
All right, then, we'd like to thank you so much, Professor Bola Akinteriwa, Director General of the Bolitag Center for International Diplomacy and Strategic Studies. Thank you so much for your time.
Thank you for having me. Thank you.
Moving on, Ghana's President Nana Akufo-Addo has been sworn in for a second term in office at the Parliament House in Accra. The event, which was witnessed by a number of local and foreign dignitaries, follows the opposition National Democratic Party's legal challenge of the results. Despite election monitors having asserted that the vote was transparent, NDC leaders claimed the polls were rigged and plan to contest the outcome in court. According to the results released by the Election Commission, Akufo-Addo won at least 51.59% of the vote, with former President John Mahama securing 47.36%. In the meantime, Ghana's newly elected members of parliament engaged in a scuffle on Wednesday night following a disagreement on the election of a new speaker. The Speaker was to be elected by secret ballots, but MPs from the ruling New Patriotic Party kept displaying their marked ballot papers to the displeasure of opposition MPs. At some point, ruling party lawmakers snatched the ballot papers while voting was still underway, sparking a confrontation. Armed police and troops temporarily stormed into the chambers to restore calm. Now both the opposition and the ruling party have 137 MPs each, and there is one independent member of parliament. Joy News TV correspondent Joseph Gakpo joins us live on the program to tell us more about this. Thank you so much, Joseph, for speaking to us on the program. What more can you tell us about last night's scuffle in Parliament?
It was a very chaotic scene. We had armed police and military men holding guns, wearing face masks, wearing metallic caps. A number of them, about 40 to 50 of them, enter the Chamber of Parliament, something that is unheard of in the history of Ghana's Parliament. It's a restricted area for uniformed people, and usually not even police persons are allowed in there. But we saw them moving, allegedly on the commands of officials within the government. And the funny part is they didn't move in exactly to arrest anybody. They just moved in just to kind of intimidate some of the MPs there and show them that if push gets to shove, they could deal with them. There was a standoff, there was body pushing between the security folks and the minority MPs. That lasted for well about 30 minutes before they were eventually ushered out of the chamber. Eventually the voting was done. One of the majority MPs did pick up ballot papers in the course of the voting. In fact, after that, when there was counting, he attempted running away with it. He was caught and the papers were retrieved. Not just that, some of the NDC MPs destroyed the ballot box and put up the stand during the voting was happening. So there was a lot of drama that unfolded in the House.
It appears so from the pictures we are seeing. Now, President Akufo-Addo has been sworn in for a second term in office. What impact does this, have on the legal petition filed by the NDC party that's challenging his victory?
With people watching,
absolutely nothing. He can go ahead and govern the country, appoint his ministers, get the nation running until the court determines the petition.
All right, then. Thank you so much, Joseph Gakpo, Joy News TV correspondent. Thank you for your reporting. Well, South Africa has reached a grim milestone in the fight against COVID-19 after reporting the highest single-day deaths and new cases as it wrestles an aggressive new wave of the virus. Health Minister Zweli Mkhize announced that 844 deaths and 21,832 new cases were recorded, with most casualties in Eastern Cape Province. The previous record for single-day deaths was 572 patients in July. Now, the country has so far recorded 31,368 deaths since the pandemic started in March 2020. In the meantime, the World Health Organization, WHO, says that there is no sign that a coronavirus variant identified in South Africa can resist vaccines. WHO's technical chief, Dr. Maria van Kerkhove, said those infected with different variants had the same symptoms of the disease and there is no severity. But she warns that the variant has increased transmission. Well, let's speak now to our South Africa Bureau Chief, Betty Dibia, joining us now from Johannesburg. Betty, 844 COVID deaths in one day. That is quite frightening. What urgent measures are being put in place to bring down those numbers?
Well, government is not relenting on efforts that have been put in place all along. In the past few days, since Christmas, we've been recording quite high numbers. But for the first time, yesterday, we recorded over 21,000 confirmed cases and high numbers of fatalities, 300 plus, 400 plus, and then yesterday over 800. Half of that or more than half of that from the Eastern Cape. So they're doing quite a lot what they've been doing all along, but what we know now is that we're seeing sign-offs on agreements regarding vaccines, which the government has said they've, for now, apart from all the other efforts in that draft rollout plan, they have signed off on an agreement with the Serum Institute of India to provide 1.5 million doses of the AstraZeneca vaccine, starting from January and February, mainly for health workers. That will cover about 750,000 health workers. So that will start this month, 1 million doses this month in January, and 500,000 in February, mainly covering health workers, and all the other negotiations are still on. That's what they're trying to do now. It's quite frightening, and the high numbers of fatalities is quite worrying, although the number of recoveries is still high relatively, but we still have over about 190,000 active cases in the country.
Now, with these high rates of infection and the death toll, are South Africans taking the observance of the COVID-19 protocols more seriously? What's been their reaction to this?
Those who are worried. Those who are hoping vaccine will be it all and answer all are there, and the government is still speaking to the people. But we know that some of the practices are still in place. The issue of social distancing, now that alcohol has been banned, numbers are still very high. Even in some cases, the funeral practices. I just came upon a story in the Eastern Cape, which I said has the highest number of fatalities in the country, COVID-related fatalities, that is, where the COVID conformed burials are being turned over, where they believe that their dead are being are traumatized or are not resting in peace because they're wrapped in the protective plastic that they bury people who have died of COVID, has been done. So some are exhuming the bodies and reburying them according to their traditional practices. Of course, the health implications of things like that. These are some of the issues that the government is dealing with and still speaking with the people, apart from beefing up hospital capabilities. But the cases are increasing, and government is still appealing to the people to just adhere and just take this seriously. But more and more people are knowing one or two people or more that they know who have died of COVID. So it's not so distant anymore. And they're hoping that probably with the arrival of vaccines this month for the health workers before others, the COVAX and the others that they're looking at in that draft rollout plan, will help out. But the government is still appealing for non-pharmaceutical interventions, meaning people need to be more careful. And they're bracing up for more numbers, especially in the metropolitan areas like Gauteng, where you have Johannesburg and Pretoria and Ekurhuleni. For people coming back from the holiday, numbers are expected to go higher, and they're just hoping that that can be managed much more.
All right, then, indeed, people need to be more responsible. But just before I let you go, are people really obeying, the lockdown restrictions also?
Well, the curfew, people are obeying. But you know that you can't police the issue of social distancing except you want to live with the people, but the police cannot do that. So the issue of masks in public, now it's a criminal offense. You can't go out without a mask in public. You either go to jail for 6 months, no more than 6 months, or you have a fine, or both. So people are trying to adhere. Whether they're wearing their masks properly is another thing, because you come across a group of people with a mask on their faces, but their noses are left out in the open. But we know that according to the WHO, you have to have your nose and your mouth, covered. So people are wearing masks. Whether they're wearing properly is another thing. And then in their own spaces, what they're doing is another thing that cannot be policed. So that may, be hampering efforts by government and those who are actually well-meaning and adhering.
True. Thank you so much, our South Africa Bureau Chief, Bessie Dibia.
Thank you very much.
The authorities in Kenya's coastal county of Mombasa have sacked hundreds of striking doctors, including the head of the doctors' union in the county. Reports say the purge affected 86 doctors, bringing the total of sacked doctors to 514. Kenyan doctors went on strike over poor remuneration and working conditions. They want to be issued with protective gear even as they handle COVID-19 patients. Now, this comes after dozens of health workers have died after contracting coronavirus. Well, let's get more on this story. Well, joining us now is Kenyan journalist Teddy Eugene Otieno. He joins us now from Nairobi. Thank you so much, Teddy, for speaking to us. Sacking doctors in the midst of this pandemic. How are Kenyans reacting to this?
Well, a very good evening to you, Layo, coming live from Nairobi, Kenya. I'm Teddy Otieno. Well, the strikers, without a doubt, crippled services across hospitals in the country. Just late last year, towards New Year's Eve, 2 patients actually died in Nairobi in the coastal city of Mombasa, during which the medics had already downed their tools. So, of course, it's a clarion call from many Kenyans who've now been forced to move from the public hospitals to go into the private hospitals to seek treatment. And remember, of course, the private hospitals are a bit much more expensive. Well, indeed, just besides that, there is, of course, the calls from the families of the medics who are on the front line. For instance, we've had 14 doctors who've died so far in the country, who've succumbed to COVID-19. So you can imagine the agony of the families of these particular medics ever since.
Now, what exactly is the government's reason, for sacking these doctors at such a trying time?
Well, and it is unfortunate when you look at it from just the naked eye perspective. But then the government, especially now, the county government of Mombasa, is questioning why these doctors have gone to the streets, why they're picketing, and they were actually sacked in what the county cited as boycotting duty. And they've actually asked these medics to hand over county property that is in their possession. Besides that, KMPDU, which is the Kenya Medical Practitioners and Dentists Union, has vowed to go to court because they're saying the strike is legal. 220 doctors in Mombasa County, 800 nurses, 86 of them fired.
Now, the government, we know the doctors have been, asking for better working conditions before now. What has the government done so far to meet these demands, some of whom, like you mentioned, have died from COVID-19?
Well, Layo, towards the end of last year, they had a sitting with the medics, KMPDU to be precise. But then again, what happened is they did not agree with all that was said on the table by the doctors. So a few weeks later, the doctors went back to the streets because why? One, they're talking about the insurance premiums that they do not have. They're talking about the health cover. They're talking about the remuneration. Some of them have gone for months without payment. Just to cite an example, there's a doctor who died last year who went for months without even receiving payment. There is also the non-remittance of the statutory payments that they make to NHIF, which is the National Hospital Insurance Fund. So these are some of the issues that the doctors have outlined as they take to the streets to demonstrate. So the government has been handling some of them. Like one, the government talked about providing adequate PPEs to the 7,200 doctors spread across the country under KMPDU. They also talked about offering comprehensive insurance, I beg your pardon. But then to date, some of these issues that are outlined by the doctors for years now have not been addressed.
Now, just before I let you go, Teddy, what are you hearing from these doctors that, have lost their jobs now? What would be the way forward for them?
Well, besides wanting to go to court because they're saying the strike is legal, some of them now have been left hanging in the balance because now there are those who who actually went on strike and they weren't paid for quite a number of months. And then those who were on strike, but then they received salaries. So you can imagine when the county government, for instance, of Kisumu, which is a lakeside city here in Kenya, announced that 429 nurses who were on strike will not receive the salaries. So these are people who are going to go for months without salaries. These are people who've just taken their kids to school because schools reopen here on the 4th of January. Schools reopen. So you can imagine the burden that is facing these doctors and the healthcare workers across the board. So it is agonizing for them. It is quite a trying time, but they've vowed to fight on, and fight they will, according to their unions.
All right, then. Thank you so much, Teddy Eugene Otieno. Thank you, Kenyan journalist. Thank you for your time.
Thank you very much, Layo.
Well, back here in Nigeria, applicants who visited the NIMC Center in Lagos for their National Identification Number registration today were left disappointed as they could not process their forms due to an ongoing industrial action embarked upon by senior staff of the commission. The applicants, who expressed concerns over the impact of this action on the already cumbersome registration process, are calling for empathy from the government. Meanwhile, the unit chairman of the Senior Staff Association of NIMC, Comrade Joseph Olukayode, blames their action on perceived neglect of their welfare by the government.
At the National Identity Management Commission's office in Lagos, nobody is allowed into the premises for NIN registration purposes. The applicants are taken aback by this decision and would not move until they know why. The news finally breaks. Workers of NIMC are on strike and the applicants feel undermined. They raised several concerns, including possible extension of the January 19th deadline for SIM NIN integration.
In this digital era, there could have been a better platform where people could have done this thing at ease from wherever they are. They are capturing, they could have done everything on it and then get the NIMC number.
I've done this in 2017 because of the thing did not come out. I'm coming from Ikotun to come and identify the problem here. It's not fair. At least they should create more centers for people that have problem.
Some of the applicants refused to vacate the entrance to the NIMC center in anticipation of a change of mind by the staff.
Another story of the staff welfare has not been packaged.
The leader of the unit's chapter of the Senior Staff Association, Comrade Joseph Olukayode, says it's official. He lists several issues, including staff members not being effectively protected against COVID-19, as well as their welfare packages, which has not changed since 2013, as some reasons for the decision to withdraw their services.
The management of the commission has taken our patience for granted. Hello? This year we have waited till 2021 to ensure, to see that the proper enumeration due for us were incorporated into the 2021 budget, but to no avail. We really sympathize with you all. It's not an easy thing.
Within the premises, only a few staff are present, with offices locked and registration sections completely empty. With the January 19 NIN SIM integration deadline still unchanged, this industrial action might just be a clog that must be removed from the wheels of progress. Chris Elamps, Channels Television News.
That's where we end the program for today. Thank you so much for watching. I'm Layo Adegoke.